The scopolamine transdermal patch is designed for continuous release of scopolamine following application to an area of intact skin on the head behind the ear. The system is formulated to deliver approximately 1 milligram of scopolamine to the systemic circulation over 3 days. It is contraindicated in patients with glaucoma. It has been reported to exacerbate psychosis, induce seizures, and cause drowsiness, confusion, and sedation. Due to its anticholinergic properties, scopolamine can decrease gastrointestinal motility and cause urinary retention. Nurses should perform more frequent monitoring during treatment with transderm scope and discontinued transderm scope in patients who develop difficulty in urination. Transderm scope contains an aluminized membrane. Skin burns have been reported at the application site in patients wearing an aluminized transdermal system during an MRI scan. Removal of the transderm scope before undergoing an MRI. The application instructions for the scopolamine transdermal patch. Only wear one transdermal patch at any time. Do not cut the transdermal system. Apply the transdermal system to the skin in the post-auricular area, or the hairless area behind one ear. After the transdermal system is applied on the dry skin behind the ear, wash hands thoroughly with soap and water and dry hands. If the transdermal system becomes displaced, discard the transdermal system and apply a new transdermal system on the hairless area behind the other ear. For surgeries other than cesarean section, apply one transderm scopolamine transdermal system the evening before scheduled surgery and remove the transdermal system 24 hours following surgery. Patient teaching and education. Transdermal scopolamine may impair the mental and/or physical abilities required for the performance of hazardous tasks such as driving a motor vehicle, operating machinery, or participating in underwater sports. Concomitant use of other drugs such as alcohol, sedatives, hypnotics, opiates, and anxiolytics that cause central nervous systems adverse reactions or that have anticholinergic properties may increase this impairment. Inform patients not to operate motor vehicles or other dangerous machinery or participate in underwater sports until they are reasonably certain that transderm scopolamine does not affect them adversely. Scopolamine can cause temporary dilation of the pupils, resulting in blurred vision if it comes in contact with the eyes. Advise patients to wash their hands thoroughly with soap and water and dry their hands immediately after handling the transdermal system. Upon removal, fold the used transdermal system in half with the sticky sides together and discard in household trash in a manner that prevents accidental contact or ingestion by children, pests, or others. Antihistamines. Meclizine is an example of an antihistamine that is often used to treat motion sickness. The mechanism of action. Antihistamines block H1 receptors in the vestibular center and may also block acetylcholine. Specific administration considerations. Antihistamines are contraindicated in patients with glaucoma or an enlarged prostate gland. Doses should be started 1 hour before traveling begins. Patient teaching and education. Do not exceed the recommended dosage. Be advised that drowsiness may occur. Avoid alcohol, sedatives, and tranquilizers which may increase drowsiness. Avoid alcoholic drinks. And be careful when driving a motor vehicle or operating machinery. Dopamine antagonists. Prochlorperazine is an example of a dopamine antagonist used to treat nausea and vomiting. It can also be used as an antipsychotic medication. The mechanism of action of prochlorperazine blocks dopamine in the chemoreceptor trigger zone. It also calms the central nervous system and may also block acetylcholine. Specific administration considerations. Prochlorperazine can be administered orally, intramuscularly, rectally, or intravenously. It is contraindicated in children under age 2 or under 20 pounds. Severe side effects have occurred when used to treat psychosis. Patient teaching and education. Patients should be instructed to take medications as prescribed. They should avoid alcohol and other CNS depressants. Patients may experience increased photosensitivity, and extreme temperatures should be avoided. Patients should be advised that urine may turn pinkish to reddish brown. Prokinetics. Metoclopramide is an example of a prokinetic medication. Prokinetics, the mechanism of action. Metoclopramide blocks dopamine and may also sensitize tissues to acetylcholine. It is used to promote peristalsis to empty the gastrointestinal tract and thus reduce nausea. Specific administration considerations. Metoclopramide can be administered orally, intramuscularly, and intravenously. The onset of pharmacological action of metoclopramide is 1 to 3 minutes following an intravenous dose, 10 to 15 minutes following an intramuscular dose, and 30 to 60 minutes following an oral dose. Pharmacological effects persist for 1 to 2 hours. Metoclopramide should not be used whenever stimulation of gastrointestinal motility might be dangerous, such as in the presence of a gastrointestinal hemorrhage, mechanical obstruction, or perforation. Metoclopramide is contraindicated in patients with pheochromocytoma because the drug may cause a hypertensive crisis. Metoclopramide should not be used in epileptics or patients receiving other drugs that are likely to cause extrapyramidal reactions because the frequency and severity of seizures or extrapyramidal reactions may be increased. Rare reports of neuromalignant syndrome have occurred. Patient teaching and education. Teach patients to immediately inform the healthcare provider if they experience new feelings of depression or abnormal muscle movements they cannot control, such as lip smacking, chewing, or puckering of the mouth, frowning or scowling, sticking out the tongue, blinking and moving the eyes, shaking of the arms and legs. Serotonin antagonists. Ondansetron is an example of a serotonin or 5-HT antagonist, often used to treat severe nausea and vomiting associated with chemotherapy, postoperative nausea and vomiting, and hyperemesis during pregnancy. Ondansetron blocking the 5-HT3 receptor. The mechanism of action. Ondansetron blocks serotonin receptors in the GI tract, the chemoreceptor trigger zone, and the vomiting center. Pharmacology. Gastrointestinal. Antiemetics. Nausea and vomiting are common conditions. Nausea is the unpleasant sensation of having the urge to vomit, and vomiting, or emesis, is the forceful expulsion of gastric contents. There are many potential causes of nausea and vomiting, such as morning sickness during pregnancy, gastroenteritis and other infections, migraines, motion sickness, food poisoning, side effects of medicines, including those for cancer chemotherapy, gastroesophageal reflux disease and ulcers, intestinal obstruction, poisoning or exposure to a toxic substance, diseases of other organs such as cardiac, renal, or liver. Nausea and vomiting are common and are usually not serious. However, the healthcare provider should be contacted immediately if the following conditions occur: vomiting for longer than 24 hours, blood in the vomit, also cause hematemesis, severe abdominal pain, severe headache and stiff neck,